Multiple miscarriages happen in about 15 to 20% of pregnancies. About 30 to 50% of miscarriages occur very early, that's before a missed period. In women who have history of 2 or more previous losses, the risk of yet another miscarriage increased to about 40%. What causes miscarriages? How can I prevent miscarriages? What are the effects of miscarriages to the couples or the woman affected? How are they dealt with? But remember, there is more hope after a miscarriage. We wish that you get pregnant again, keep the pregnancy, and have your rainbow baby. Having to lose a child or miscarry can crumple your world. Many women go through this, and it's no joke at all. Going through a miscarry can affect the couple or the woman involved. Are we ready during the period of pregnancy that a miscarry can occur, and how prepared are we? Having to lose a child is a whole lot to take in. How much more having a habitual or frequent miscarriage? So on today's episode, we'll be looking at miscarriage or multiple miscarriages. The show is the Pregnacare show, and my name is Dede. Welcome to the show. So on today's episode, we'll be looking at miscarriage or multiple miscarriages and how they affect us as individuals or family. So for today's episode, we still have Dr. Sharon with us. She's going to enlighten us more on what causes miscarriages, problems of miscarriages, and everything about miscarriages. Hello, Dr. Sharon.
Hi, Dede.
You're welcome once again to our show.
Thank you.
So viewers, we'll go for a short commercial break. When we come back, we'll find out what miscarriage is. Welcome back. If you just joined us, it's still the Pregnacare show, and we are looking at miscarriages or multiple miscarriages in pregnancy. So Dr. Sharon, when we talk of miscarriage, a woman has miscarried or multiple miscarriages, what are the differences and what does that mean?
So a miscarriage is basically losing pregnancy before 28-week gestation, okay? And then multiple miscarriages is losing more than 2 or more pregnancies in your lifetime, basically.
Okay, so would we say abortion is same as miscarriage?
Yeah, you can use them interchangeably, but people don't want to use the term abortion because then it sort of connotes, I mean, that's how we have made it, to connote that you terminated the pregnancy yourself rather than it ending
in a natural,
exactly, a natural cause.
How common is a miscarriage in our society?
Oh, it's quite common. I was just reading, and it says that about 15 to 20% of people, I mean, of the population, pregnancies that we have, the people miscarry. Okay. Yeah, so basically,
is that 15. Common?
Yeah, that's common. Okay. 15 to 20% is
quite
big.
High.
Yeah, it's high.
Okay. So what could be a cause, or what are the causes of a miscarriage or multiple miscarriages?
Okay, so the causes can vary. Okay, we have genetic causes, we have hormonal causes, structural causes, infections. Okay, for the genetic causes, sometimes the baby itself is not well formed, so has some form of congenital anomaly that's not compatible with life. God in his wisdom doesn't want this baby to come into the world and come and suffer, so basically baby is already terminated before they reach viability. Also, when it comes to the hormonal things, sometimes certain conditions, you know, can have an effect on your hormones, and if you don't have adequate levels of your hormones to support the pregnancy, you could lose the pregnancy. So if you have, like, your thyroid hormones are deranged, your prolactin hormones are deranged, even in cases such as diabetes and all that, they can all affect your hormone levels, and then that could cause you to have a miscarriage as well. Also, structural things, if you have sometimes fibroids, you know, depending on where the fibroid is found in the womb, if it's found in the lining of the womb and it distorts the lining of the womb, it can affect implantation and then also have you miscarry because the baby is not well implanted. Okay.
So could stress also cause miscarry?
Yes, stresses can cause miscarriages because stresses can affect your hormones and then they can also cause you to miscarry.
What are physical factors, maybe trauma or something?
Definitely. So if you have a traumatic injury or anything traumatic to your pelvic area, even sometimes when people are even startled and all that, you know, sometimes all these things can cause miscarriages.
Okay. So what of blood issues? Probably I know of someone being O positive or O negative. She's carrying a child of the opposite.
Yeah, so those are the rhesus issues. So that's also possible. Okay, that's why you would usually say that you need to know your partner, you need to know your partner's blood type and all that, and know if you are compatible with it before you get to that stage. Okay, so yeah, sometimes when you, depending on the blood group, yes, of your partner, it may cause you to have spontaneous abortions.
Do you also have any unknown cause of miscarriage? Probably the person doesn't know.
Sometimes, sometimes. So saying that about sometimes most of the miscarriages that we have, the person doesn't even know that they've had a miscarriage. Because before they even miss their period, they would have miscarried. So they think that it's their normal period that is coming in, but it may have been a miscarriage.
And she's not even aware that she's miscarried.
Yes. Mostly those things are genetic stuff, congenital stuff that doesn't make the baby survive. Okay.
So do we have women that higher risks of miscarrying?
Oh yes, definitely. As I said, if you have a genetic something that makes you unable to or affects pregnancy, you may be at a higher risk of miscarrying than someone else. Also, there's this, you know, immunology interplay. Okay, so if you have anything any immunologic factor that affects pregnancy, you know, anytime that you're pregnant, you may be at a risk of losing the baby. Yes.
Okay, so what are some of the things that will show that a woman has miscarried? Probably I'm pregnant, probably in my early stages. So what will show that I have miscarried, or are there signs and symptoms that shows that this person has miscarried?
So first of all, for you to miscarry, you need to know that you are pregnant. So you need to confirm the pregnancy. Once pregnancy has been confirmed, if you have maybe any lower abdominal pain, spotting, vaginal spotting during pregnancy, you are bleeding during pregnancy, you see any tissue coming out, yes, during pregnancy, all these things are signs that you may be miscarrying.
So from your earlier explanations, at a point you said that someone could actually miscarry without even knowing she's pregnant. So how does that apply as well?
Okay, so such miscarriages, the one that the person doesn't know that is pregnant, usually they go as undiagnosed miscarriages. Yes, it's research that is telling us that most miscarriages are even undiagnosed. Yes, but for the ones that are diagnosed, they need to confirm the pregnancy
they are pregnant
first
before they actually told they've miscarried.
Yes, so that if you know you are pregnant and you know you've lost the pregnancy, you know you've miscarried.
Okay, so can't I feel anything in my body that will tell me?
Oh, you can actually. So sometimes, you know, when you're pregnant, you have some symptoms. You have tender boobs, sometimes your mouth tastes bitter, you feel a bit low on energy, a lot of nausea. So when you're about to miscarry, sometimes you realize that these symptoms come down. Like your boobs are not tender anymore, your breasts are not tender anymore, you don't feel as nauseated as you would before and all that. These are a few signs that you can pick up.
Okay, so when someone miscarries, how long does she go back to the pre-pregnancy stage? I'm asking this because there was this woman who, she was actually pregnant, she miscarried, but she's been doing the pregnancy test for like I think 3 more weeks, and she was still reading the kit was still picking it as pregnancy. So I was trying to explained that the pregnancy hormones were still in, but she didn't get it. So we just want to know, how long does it take?
Usually in about 21 days, the hormones should clear. They should go down. So maybe after 21 days, when you test, you should have a negative test.
And all those pregnancy symptoms,
they would all go. As for the pregnancy symptoms, the minute you miscarry, it starts coming down, and it goes down really fast. Okay, except that you may be having a positive test, till about after 21 days after the miscarriage.
Okay, so how is a miscarriage treated? Probably I've come in, I'm pregnant, and I realized I'm bleeding, or there are some clots or something coming out. How do you treat it? Is it surgical or medical?
It depends. You can do both medical and then surgical. It depends on the stage of the pregnancy. So if it's less than 9 weeks, you can use the medical treatment. If it's over that, you can use a surgical treatment. So it really depends on the stage of the pregnancy. And also, if most of the products have come out, the product of conception, if it has come out. So a scan will give you all that information, and then you would know whether to go in and intervene or to allow the thing to come out on its own.
Okay, this is not a nice saying, but then I guess some people are fortunate, meaning that you can actually have a miscarriage when you know you are not like you don't even know you are pregnant. So you have it, that you don't go through the stress of having to be managed. But some as well would have to go through the surgical procedure, the DNC, I think.
Okay, lately we don't do DNC as much. We do something called an MVA.
Okay,
that's manual vacuum aspiration. That one is safer, and less complicated as compared to the DNC. Yes. So
how many miscarriages are too much?
I think it is based on the individual. Losing one baby is a big deal already. So you can't really put a tag on it and say that, oh, if you have 2 miscarriages is too much, if you have whatever miscarriages is too much. But medically, they'll say that if you have 2 or more miscarriages, then you're having multiple miscarriages, and it needs to be looked into. The cause needs to be, looked into, so that if whatever we find can be used to help you in your next pregnancy.
So does multiple miscarriages mean infertility?
Not necessarily.
Okay, so
you are not infertile. At least you're able to, get pregnant, except that for one reason or the other, you're not able to carry the pregnancy through. So we have to find out why you're not able to carry the pregnancy through and try and intervene, so that in your next pregnancy, you can carry that pregnancy through. Okay,
so couples experiencing multiple miscarriages, should they see a fertility doctor?
Definitely.
Is there a worry should it be a worry that...
Yes, they should see a fertility doctor right away. Honestly, I would say that if you experience one miscarriage, it's good enough to see a fertility doctor when you're pregnant the next time. You don't have to wait to get a second one before, like you have to meet a certain criteria. Okay, I'm not there yet because I don't have 2 miscarriages. When I get 2 miscarriages, then I'll go. Are you going to wait to lose the second one first? So personally, 1 is enough. I would go and see a doctor if I have had 1 miscarriage.
Okay. So doctor says that personally she would go and see a fertility doctor after she has miscarried once, and also know that having multiple miscarriages does not mean you are infertile. At least there is hope that you get pregnant, keep the pregnancy, and have your baby. We'll go for a short commercial break. When we come back, we'll hit the street to find out what our viewers have for us on today's topic.
Flourish Formula is a liquid herbal iron extract with the benefits of organic iron 3 polymaltose plus vitamin C and other B-complex vitamins, the base of fruit juices and yeast. Flourish Formula helps increase your energy level, stamina, and highly nutritional, and also reduces tiredness and fatigue. It contains vitamin B1, B2, B6, B12, and C. Flourish Formula helps keep the family smart, healthy, and strong. For enquiries, contact Unicom Chemist Limited on 0302 324 595 or 0302 324 383. You can also email unicomchemist@yahoo.com or visit www.unicomchemist.com. This advert is FDA approved.
Welcome back. If you just joined us, the show is still the Pregnacare, and we are looking at multiple miscarriages in pregnancy. Let's hit the street to see what our viewers have for us on today's episode.
I would like to find out if men can be a contributing factor or intercourse can be a contributing factor for miscarriage.
My name is Charisma, and I'd like to ask, do men have anything that might be a contributing factor to miscarriage?
So those were some questions from our viewers on the streets. Dr. Sharon, a viewer would want to know, are there any causes from the side of men that cause multiple miscarriages?
Yes, you remember we mentioned the blood group incompatibility. Yes, so that is something that could be a contributing factor from the man's side. And also when it comes to infections, okay, if your partner has a sexually transmitted disease which could affect the baby, example chlamydia, and it gives you that disease, that could also cause miscarriages.
Okay, so the next person would want to know, is there hope after having multiple miscarriages? How soon can you conceive, or do you have chances of conceiving again after multiple miscarriages?
Definitely, you have chances of conceiving again. We just need to figure out why you are having the multiple miscarriages. Once that is sorted out, if it can be intervened, an intervention is planned, you know, for your next pregnancy, and then you can probably have that baby without any problems.
So Dr. Shan, we want to know, how soon can couples resume sexual life after a miscarriage, or when should couples try to conceive again after a miscarriage? Okay,
usually we'll give you a 3-month break to sort of rest, let your hormones settle down and all that, so that, I mean, you don't confuse the body, more or less, yes. But usually after 3 months, you are good to go.
After 3 months, you can try again. Please. Okay, so.
But it also depends on your peculiar condition.
Okay, so that as well, you want to personalize it.
Yes.
But 3 months is medically
generally, about 3 months you can try again. But if the person, for a reason or not, depending on that person's particular condition, they need to wait more than that, and then the doctor would advise on that.
Okay. So do you think multiple miscarriages or miscarriage put threats on marriages?
Definitely. I mean, it's not easy to go through a miscarriage, and the emotional bit, the psychological bit, the financial bit, all that. I mean, it's draining. So if both of you are not strong enough and you are not able to understand each other and then support each other, it's very easy to put a strain on your marriage and even break you up.
Okay, so with your field of work, how do you see such couples? How do you go about them? What do you tell them? How do you encourage them? Because it's painful to lose a child or to miscarry. So how do you support them psychologically?
So in our part of the world, one thing that we tend to downplay a lot is clinical psychology. Yeah, so basically after you have spoken to the person, we try not to end that in the consulting room. We try to employ the clinical psychologists, bring them on board to manage the person after till they are out of the woods. Okay, because a lot of women go through this, but it's like they don't talk about it. Unless something happens, you see that there are lots of people who talk about it and it's so painful. So that's why I'm asking, what kind of help you give them during that phase? It's always good to have the clinical psychologist see them after you are done with them in the consulting room. Okay, so should there be a blame game on miscarriages? Should we blame someone, a man or a woman? It's a very unfortunate situation. So I don't see why you would want to blame somebody, or the person is already in pain. Why would you want to cause more pain to the person by blaming this person or blaming that person? It's not necessary. I think all energy should be channeled into figuring out why there's a miscarriage and trying to prevent it in further pregnancies. That's it.
Does miscarriages, does it affect men? How do they act? Because I know you've seen a couple of them, so does it affect them? How
Yes,
do they act,
psychologically, yes, it affects them. They may act tougher, they may act like they are okay and all that, but then when you delve deeper, you realize that it affects them. That's why it's always good to have some therapy for them, both the woman and then the man, after they have been seen and after they have lost the baby and the medical part has been settled.
Okay. So I hope that there are preventive measures on miscarriages. So if they are, what are some of these? So that viewers could get enough
as I
knowledge.
said, it depends on the cause of the miscarriage. If it's something like congenital, the baby not forming well or something, you cannot do much about those ones. But then if it's something like fibroids, you can take it out, okay, so that your next pregnancy, you don't have it. I know a lot of people will say they can drink one medication or one mixture of concoction or something to sort of melt out the fibroids, but the management for fibroids truly is surgical, so you have to take it out so that in your next pregnancy you don't have it. If it's the ABO incompatibility thing, there are things that you do. So whatever the problem is, that's why you have to always see a fertility doctor to help you diagnose the cause of the miscarriage. So when you're able to diagnose that, you can talk about the preventive measure for that particular situation. Okay,
so what advice as well will you give to a woman who has had multiple miscarriages and probably she's currently pregnant? Is there any special advice you could give them on rest, on nutrition, on...
She should not joke with her antenatal visits. That's my first advice to you. Don't joke with your antenatal visits. Take all your antenatal visits very seriously. Visit the hospital when you are asked to visit the hospital. The least thing that you see that you feel is abnormal, go to the hospital. It's better to go for them to tell you that it's okay or it's normal, rather than stay at home and then find out later that that's what caused you to lose your baby. So don't ever get tired of going to see your doctor once you have been through that before. The least thing, just go.
So how important is bed rest in such cases? Because I know that there are cases where a woman who has had multiple miscarriages, she's pregnant, they're asking her to bed rest, but she doesn't get it.
It depends, as I said, it depends on the situation. If your situation, like you have a Previa or something and they're asking you to rest, you have to rest. You know, they're asking you maybe not to have sex, you should not have sex. Like, depending on what you have, they may ask you to have bed rest, like don't move out, don't go anywhere. If you have a cerclage in situ, there are certain things that you're not going to do. You're not going. Yes, they'll encourage more bed rest for such people. If you are supposed to have bed rest to help keep your baby, I think it's a very little price to pay, you know, to be able to see your child through, your pregnancy through, and then yes, up to term. Okay.
So if you've had multiple miscarriages before and you are currently pregnant, do not joke with your antenatal clinic. Always make sure you see the doctor. If there's anything abnormal with the pregnancy, do not hesitate to see your doctor, because we wish that you carry your pregnancy to term and have a very healthy baby. So viewers, we'll go for a short commercial break.
Yo, Kojo, you look happy and strong.
Yeah, Charlie, but I couldn't have done it without you, you know. Madam was always complaining, but ever since you introduced me to Spetonic, life has been good.
Spetonic helps boost the immune system, fitness level, and performance. A tablet a day is all you need, babe.
Spetonic, strong as a wood. For inquiries, contact Unicom Chemist Limited on 0302 324595 or 0302 324383. Email info@unicomchemist.com.
Spetonic is not suitable for persons under 18. This advert is FDA approved.
Welcome back. So Dr. Sharon, what would be your final words to our couples or our pregnant women out there, or someone experiencing a child loss, or somebody who has gone through multiple miscarriages? What would you tell them? What encouragement will you give them?
Okay, so I think that if you have had one or more miscarriages, first of all, consult your doctor, try and find out why you're having the miscarriages, and then plan prevention strategies for your next pregnancy so that you can carry the pregnancy through term. And I think society also needs to be kind and then nicer to people who have gone through miscarriages, because really it's not easy losing a baby. It's a very difficult thing and a very emotional thing that they are going through. So it's very good to be nicer to them and kinder to them rather than ostracizing them and then making fun of them.
Dr. Sharon, where can we find Accra Medical Center? Social media, your location, what do you do at Accra Medical Center?
Okay, so Accra Medical Center is a 45-bed ultra-modern facility located in Ringway, opposite the police headquarters. The services that we provide, we have GP services, we have imaging services, we have specialist services. For the imaging services, we do ultrasounds, x-rays, we do CT scans, MRIs. For the specialist services, we have ophthalmology, dental, gynae, rheumatology, endocrinology, pediatric services, and then all the medical services you can think of. You can find us on social media, on all the social media platforms. On Instagram and Twitter, you can find us at Accra Med Center, and then on LinkedIn and Facebook, it's Accra Medical Center. Our telephone number 0204 096 099. 0204 096 099. Thank you.
Thank you, Dr. Sharon, for coming on today's episode.
My pleasure.
Pregnacare is very grateful for always having you on our show.
Anytime.
And then we look forward to having you more on the show.
Definitely.
So our tip for today's episode is: do well to be taking your folic acid every day, beginning at least a month or two before conception. If possible, make an effort to eat healthy and well, manage stress, keep your weight within normal limits, and stay away from smoking, drinking alcohol, taking unprescribed drugs, and any other harmful substances that might cause you to lose your pregnancy. So today we were looking at what miscarriages were, and we find out that it is very common in this part of the country, and then it is not easy to lose a child. As a woman or a couple, if you've miscarried or you've had multiple miscarriages, try to see your fertility doctor, find out what is causing your miscarriages, and attend to it as well. When you are pregnant as well, make sure you do things that will keep your pregnancy. If you are the one at risk of having multiple miscarriages, whatever advice has been given to you by your doctor or your midwife, make sure you adhere to them and keep safe. We are praying and hoping that you get pregnant again, you keep the pregnancy and have your rainbow baby this time. Thank you for joining us on today's episode. The show is still The Pregnacare. You can reach to us on all our social media platforms at The Pregnacare Show. Keep subscribing to our YouTube channel at The Pregnacare Show. You can follow me on my page or leave a comment on my IG page at @dede_Gawu, and we will attend to them ASAP. Thank you for watching this week's episode. See you next week.